If you're dealing with sciatica, you have pain going down your leg, numbness tingling, or even feel like you have a fire poker in your glute, this could be what you need. At STRIVE Integrative Health, what we do is we always start off with a consultation. We have you fill out some paperwork. This really gives us a good idea of what's going on, how long it's been happening, where it could be coming from, and really if we can help you. Once we determine if we can help you, we bring you back into one of the exam rooms. So I'll have you go ahead and follow me back here. As you come back to one of the exam rooms, you can see our testimonial walls, just previous patients that have had a great experience here in our office. But we have multiple exam rooms, so if you go ahead and come on in here, what we do is we have you take a seat here. The doctor reviews all your paperwork to find out what's going on before they even come in. Of course, once they come in, they'll ask you a couple more specific questions, really make sure they're getting to the root cause of what's going on, and then they'll dive into an exam. During the exam, we're looking for a couple very specific things. A lot of our patients, when they're having sciatica, it's coming from that spine. So we have to remember the brain is the control center, goes down through that spinal column, and then out into these peripheral nerves. What can happen is we can start to have misalignments where it puts pressure on those nerves, or even we can start to have a compression on that disc, or even a disc herniation or a disc bulge where it puts pressure on those nerves, and then it can travel down into that leg, even all the way down into the foot. Now those misalignments to us are going to feel tight, swollen, puffy. To you they might feel a little tender or even stiff. Based on what we find, we'll take any necessary x-rays, specifically of that low back, because that's where all those nerves root from, and then go down into the legs. So what we'll do is we'll step out, we'll make sure that that x-ray room is ready for you, and we have them all in-house. What's great is we have digital x-rays, so we can see them right away. A lot of times, even during your first appointment, we're gonna go over some of those x-rays. So we'll take one looking at somebody from behind. So for this patient, left hip, right hip, you can see how they're uneven. I always explain this as like your car. If your car drove down the road and it was uneven, what do you think would happen to the tires, the suspension over on that side? They typically wear out quicker. Same thing with the joints in your spine or even into your pelvis or those hip or knee joints. We can see that things start to wear unevenly and also increase your chance of having pain or dysfunction throughout that spine. We take it a step further in our office where we'll even do motion studies so we can see exactly where it's putting pressure on those nerves. For example, we'll have our patients bend to the left and also bend to the right. This is great not only to see what's going on now, but after a series of treatments, we retake these x-rays so we can see how not only you're feeling better, but we can see that the x-rays are actually moving better too. That way we know we did more for you than just get you out of pain. We actually corrected why you were having the pain in the first place. And then my favorite x-ray to take is actually the side view. If you see here, we can see where those vertebrae are. You can even see the spaces in between. For a lot of patients, L4, L5, S1 can be very compressed. It's the highest rate of degeneration out of any patient that walks into our office. So we really want to see what's going on there, the health of the disc, the nerve, but also the soft tissue, all the muscles, tendons, ligaments that surround the area too. From there, we can really determine what helping the patient looks like, and then we'll even get you started with your first trial treatment that same day so we can get you feeling better as quickly as possible. If you have any questions, go ahead and reach out to our front desk. We can always get you scheduled for this appointment to see if we can help you.